Women in every culture, in every generation of human history, have been having babies. Yet, there are a lot of misconceptions. There's misinformation, and for many women, the process of carrying and delivering a child can be scary. The mission of North Florida Women's Care is to provide the highest standards and quality of care to our obstetrical and gynecological patients. Our goal is to make your experience positive and fulfilling. Our specialized professionals are leaders in the industry. After you schedule your first appointment with our office, you will be sent important paperwork to complete prior to your first visit with us. Having this paperwork completed before your visit will help our staff prepare your chart and expedite the visit process. At check-in, you need to bring a photo ID and your insurance card. Your initial and routine visit will include leaving a urine sample, checking your weight, and checking your blood pressure. A competent member of our clinical staff will ask you questions to ensure your chart is current and up to date. Your first blood work will be ordered. Feel free to ask any questions you may have. Next, you'll be placed in a room to meet with one of our outstanding providers. It may be that a pap smear is done to complete your health chart. Your provider and the clinical staff will answer any questions you have. It's important for your provider to understand all possible concerns. Based on your personal needs, your provider may order additional routine tests. Depending on your insurance, tests will be performed at LabCorp or Quest. We'll help you get there by providing maps and directions. North Florida Women's Care helps people know about the importance of basic health. At each prenatal visit, your baby's heartbeat will be checked, and if needed, there will be a vaginal exam. The information will be shared with you so you and your provider can do all you can to ensure a healthy baby. After 21 weeks, fundal height will be checked. That's when the provider measures your growing tummy. North Florida Women's Care offers state-of-the-art in-house ultrasound services. Obstetrical patients are routinely scheduled for ultrasounds at the initial obstetrical visit and again at approximately 18 to 22 weeks of the pregnancy. Additional ultrasounds may be ordered by the provider if medically necessary. Some reasons that doctors might order an ultrasound are to check your baby's heartbeat, to check your cervix length, preterm labor, to check your baby's health and development, to determine the gender of your baby. This typically happens between 18 and 22 weeks. North Florida Women's Care has the highest quality ultrasound equipment available in Tallahassee. Our sonographers are experienced and compassionate about your health and the health of your baby. We want you to stay well during your pregnancy, but if you get sick, we are here to help you. Remember, you can't always take the same over-the-counter medications when you're pregnant that you might have taken before your pregnancy. Always check with our office before taking or stopping any medications. You can also reference the bright pink medication list provided in your trimester packet or available on our patient portal in the Patient Resources tab. Review the green sheet for tips on coping with nausea. This is also available in the trimester packet and online in the portal. Always hydrate. Drink lots of water. You can also call our office with any questions. We encourage you to send non-emergency questions to us through the portal. It's quick, easy, and available 24 hours a day. If you need after-hours emergency care, go to Tallahassee Memorial Hospital, also known as TMH. Our providers are on call 24 hours a day, and they only practice at Tallahassee Memorial Hospital. After your first visit, you can expect to be contacted by a pregnancy ambassador from Tallahassee Memorial Hospital. This person will provide you information about the classes and services offered to our pregnant patients. Tallahassee Memorial Hospital is the only hospital in the area with an advanced neonatal intensive care unit, providing you with the highest quality of care for both you and your baby. It's important to you, and it's important to our providers. These services will make becoming a first-time mother an enjoyable experience and provide an experienced mother with valuable reminders, as well as services important to any woman with a new baby. Being a new mother should be rewarding, a memorable experience, and Tallahassee Memorial Hospital services provide many ways to ensure your care and the health of your new child. Be fully prepared for the arrival of your sweet pea by joining Tallahassee Memorial's exclusive baby and toddler club with tips, perks, and discounts for families throughout the Big Bend. Go to tmh.org to register for this free membership that includes complimentary gifts, a newsletter, helpful advice, and exclusive discounts. Consent forms will be sent to you electronically for your signature. It is recommended that you complete these forms prior to your first obstetrical visit. However, a member of our clinical staff will review these forms with you once you arrive for your initial visit. They will be explained in detail at that time. North Florida Women's Care is a group practice of caring providers. During your visits, there will be times when you see other providers within our group. Babies have a way of coming on their own schedule, so the provider on call at the time of your delivery is likely to be the provider that delivers your baby. Our office only delivers at Tallahassee Memorial Hospital. It should be noted that our office has a no vaginal delivery after C-section policy. We are all dedicated to providing you with the best possible care. Your consent for HIV testing allows us to test for antibodies in your blood that might affect your health or the health of your baby. This includes a confidential HIV test. A positive test result means the HIV antibodies are present in your body and that you've likely been infected with HIV. This is not a diagnosis. A negative test result means no HIV antibodies have been detected in your body. Remember, this is a confidential test, and the results are only shared with the people who need to know how to best take care of you and your baby. In today's changing healthcare environment, it's your responsibility to notify us of a change in your insurance policy. Please provide us with new insurance cards. Lab services are routine during pregnancy. It's your responsibility to know which laboratory is in your insurance carrier's network. Just review your policy or contact your insurance company. Our office will not be responsible for labs sent to the wrong laboratory. The lab will send a separate bill from the bill you will receive from North Florida Women's Care. Any services provided outside our practice will be billed separately by that facility. This may include but may not be limited to your hospital bill, laboratory, radiology, pathology, maternal fetal medicine, endocrinology, or anesthesiology. A first trimester screen will allow you to be informed about the health of your baby and prepare you and your family for some important medical and financial decisions. When you come in for your first visit, a clinical staff member will ask you if you would like to have a screening performed. If so, they'll place an order to have you referred to maternal fetal medicine for that screening. You will get a call from our office with the date and time of your appointment. Screening will take place between weeks 12 and 13 of your pregnancy. You should know that some insurance providers consider this an optional screen, so be sure to inquire about your personal coverage. Now, about your Emmy. Not an award for television programs, but a very important online educational tool to help you prepare for delivery. This program provides you with a detailed explanation about specific topics. You may be assigned several Emmy programs. It's important that you watch them all completely. After your first visit, you will receive login information from the clinical staff. Visit my-emmy.com and enter your personalized access code and date of birth to log in. You may watch in the privacy of your home, share with loved ones, and view as often as you like. A rewarding and informed experience is just a click away. North Florida Women's Care offers great classes. If you choose the tobacco cessation class, you will receive a month's worth of products as well as information to help you quit smoking. This class is free of charge and available to anyone who is interested. Childbirth classes are taught by certified childbirth instructors and are offered to our patients after hours in our lobby. You can register online. The class schedules, registration, and pricing are all available online. Thank you for putting your trust in our award-winning team.